Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over 9 very common treatments that you use for occipital neuralgia. And those treatment is not effective, and I will go over the normal healing cycle so it will make sense why those treatments are not effective. So I'm gonna use an external paper cut for visualization so you can visualize what happened internally when you have occipital neuralgia, but we don't see it because the skin covered it. So the first stage of healing is inflammation stage. So when you are in inflammation stage, you start to have redness, swelling, the blood starts to rush to that area and experiencing pain. The second stage of healing is proliferation stage. That's when your body starts to build fibrotic tissue, fascia restrictions, and you start to have muscle spasm. Perfect scenario, actually, during the maturation stage, your body should get rid of everything from the proliferation stage and the inflammation stage. The problem when you have occipital neuralgia and you start to have inflammation, even minor inflammation, you're gonna compress on the nerve and you start to have the occipital neuralgia pain, and you start to have neck pain and pain going in the upper back and in the head. So inflammation and fibrotic tissue, fascia restriction gonna compress on this nerve and you start to have that sharp shooting pain going upward or behind your ear. So if you're still experiencing pain, there's a higher chance you're going back and forth between the inflammation and the proliferation stage. So we're gonna relate the treatment to the inflammation and proliferation stage so it will make sense why this treatment do not work. So the very common treatments are like heat or ice or electric stimulation. But when we look at the problem, ice temporarily could decrease the inflammation, but it's not going to do much to the inflammation or the proliferation stage. For electric stimulation, based on the study, it provides temporary pain relief, but it's not doing anything to the healing cycle. So it's not going to provide a treatment for the issue itself. The other common treatment, foam roller or massage, but the problem when you start to massage inflamed area, it's going to inflame it more. The treatment has to be targeting those issues, the inflammation, the fibrotic tissue, the fascia restriction. Those are the ones that pushing on the nerve and causing the occipital neuralgia pain. The other common treatment, acupuncture and dry needle, and when we look at the normal healing cycle, is not going to do much to the inflammation when you use needles. And the other problem is even when you have fibrotic tissue and fascia restriction, you need to have mechanical force. So the needle is not going to cause that mechanical force to release those adhesion that cause the occipital neuralgia. And actually, you can do this at home. A lot of the time with occipital neuralgia, you will start to feel a knot in the occipital area right here. And that knot could compress on the nerve that go into your head and could cause the occipital neuralgia pain. So we need to get rid of that, but those treatment is not targeting those issues. So the other common treatment is joint mobilization or adjustment, but the problem is not in the joint. Joint mobilization is basically moving the joint. The problem is soft tissue that compressing on the nerve. It could be also herniated disc, which is inflammation, and sometimes it could be fibrotic tissue from orthotic changes in the vertebra around this area. So we need to address the root cause of the problem instead of using new modalities that's actually addressing the symptoms or are not actually addressing anything at all related to the problem. The other common treatment that you see it on YouTube is stretching. When I personally do not recommend the stretching to my patient, because based on the study, stretches is actually cause more inflammation. So think about this way. So our muscle should act like a rubber band. So when you have a micro tear or inflamed area and you keep stretching, you're going to cause more inflammation. So I personally do not recommend it to my patient. It's not a safe option for treatment. The other common treatments is strengthening exercises, but the problem when you do strengthening exercises, when it's inflamed, it's gonna inflame it more. But strength exercises will not address the inflammation or get rid of the fibrotic tissue or fascia restriction. So the treatment has to address the normal healing cycle, not just addressing the symptoms or something totally different. So I'm gonna leave a link underneath this video for the 3 most effective natural treatment for occipital neuralgia. We'll see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to astrinstitute.com.